Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about a topic that you need to hear all about. And maybe you don't know everything you need to know about it, and that's about plastic surgery. Our guest today is Dr. Irina Domantovsky, a board-certified plastic surgeon with plastic surgery of New York, located in Great Neck here in Nassau County. Dr. Domantovsky, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you very much, Jeanine. Thank you for having me on the show.
You are very welcome. And so first of all, please tell me how you are doing during this very tough time of COVID-19. How has it affected you personally?
Well, it's been hard for all of us, but I've been still working throughout this pandemic, and we've remained open as a practice. And things have been more stressful than normal because of the risk that we take as physicians working in the hospital and taking care of sick patients during this tough time. But nonetheless, we have the calling for it, and so we do our job. But it's definitely been more stressful, and in having to come home to my family, the stress of potentially exposing them to the virus, it's been on my mind. But it looks like we've been doing better lately, and I'm really glad. And I think there's some positive data out there that's showing that we're doing better.
So tell me, to become a plastic surgeon, tell me, once you graduate med school, what is the process of becoming a plastic surgeon?
So it's actually a long road. After finishing medical school, which takes 4 years, you can become a plastic surgeon by doing a 6-year integrated plastic surgery residency. It's an intensive surgical training where you're exposed to all aspects of plastic surgery. And then at the end of that, you can also decide to further specialize within one of the areas of plastic surgery, such as craniofacial or cosmetic or hand surgery, and that takes another year of fellowship training. So in total, the training can be 10 to 11 years to become a plastic surgeon.
And that was your educational experience as well?
That's correct. Yes, I did a 6-year plastic surgery residency followed by 1-year fellowship in pediatric plastic surgery. So I have a specialty training in taking care of kids with plastic surgery related problems.
So what was your motive on becoming a plastic surgeon?
That's a very good question. I always liked surgery. I love being in the OR. I discovered that early on in medical school, even during the anatomy course. I liked studying anatomy and doing dissections, and I love being in the OR during my clinical rotations. And specifically, the plastic surgery allows me to use my creative skills and technical skills to help people improve their quality of life, both kids and adults. And that's what I love about it.
And how many women are plastic surgeons? I know you must be a rare plastic surgeon to have a female.
It's definitely been improving in terms of the number of women becoming plastic surgeons. And currently, there's probably at least 25% of board-certified plastic surgeons that are women. In the past, it used to be less, but over the last 10 to 15 years, there's definitely been a push to make sure that women are more involved and can pursue those specialties in surgery.
So there's a lot of stigma surrounding plastic surgery. I know it's somewhat cultural in some ways. So what is the most, frequently done plastic surgery that you perform?
So some of the most frequently performed procedures that I do are breast augmentation, abdominoplasty, liposuction, scar revision, rhinoplasty, or even non-surgical skincare injectables such as fillers and Botox. Those are some of the most common ones.
And would you say, do you ever have patients that come into your office, for example, and say, oh, I would like a procedure of breast augmentation or breast reduction or rhinoplasty that you may deem as being unnecessary? Is this your position, or do you always consider the perspective of the patient?
I definitely consider the perspective of the patient, but I also I would bring them for a consultation. I also need to ask them questions in order to understand what is it that they're trying to change and what is it that they're unhappy about. And I would also have to do a physical exam to make sure that something that they're not happy about can be surgically addressed and can be safe and would look good for a patient and something that they would be happy with. Mm-hmm. So I do sometimes have to say no to a patient or end up discussing a procedure that they may not necessarily have been looking when they first came in for it, but I have to do what's right for the patient at the same time taking into account what they're looking for and what they want. So it's a combination of things. I definitely take into account what the patient wants, but I also have to balance it against safety and kind of what the surgery can actually address and the limits and possibility of the surgery.
Tell me the age requirement for plastic surgery. I know a lot of surgery, particularly plastics, are elective. And is there an age that you might say you're too young to even consider this because you don't have a good self-image or maybe you don't have a good self-concept of what a body should look like? So do you have an age cutoff?
Certainly, that's a very good question. Specifically about cosmetic surgery, there's not necessarily a cutoff, but there usually, I find that patients become interested in cosmetic plastic surgery when they reach around college age, maybe late teens. And this goes into the reconstructive area as well, because sometimes we're born with certain facial features or certain body characteristics that we're not happy about from young childhood, and that persists. So I don't think there is an age limit, but I definitely think that most cosmetic surgeries and patients that come interested in that, I would say the earliest age would be late teens, college years.
I know some of the most common surgeries, as you said, were breast reconstruction. Tell me about the breast reconstruction these days. Are you still doing radical mastectomies? And if you are doing mastectomies, how does that perform? What is considered radical? What is considered modified? And how is that done?
So breast reconstruction field of plastic surgery deals with reconstruction after breast cancer. And actually mastectomies or even lumpectomies, where there is a partial removal of the breast tissue with the cancer, are actually done by breast surgeons who are general surgery trained. So that's a different specialty. And as a plastic surgeon, I often work with those surgeons because I do the reconstruction portion after the mastectomy is done. Radical mastectomies are definitely not as common. I probably have seen one in my training. So I would say they're the thing of the past for the most part. And now we know a lot more about breast cancer, and that has influenced how we perform mastectomies and treat breast cancer. But I, as a plastic surgeon, I am involved in breast reconstruction aspect after the mastectomy, and that can be involving breast implants or autologous tissue, meaning tissue from the patient transferred from another area of the body, such as abdomen, into the breast.
So with the implants that you with breast reconstruction, tell me the type of materials that are used for a reconstruction surgery.
So that's a good question. So there are two types of implants out there mainly, silicone and saline-filled implants. They're both excellent. They have slight differences. Silicone, I would say, is a little bit more natural feel, and it's completely safe. It's been proven to be safe for the human body. Saline implants are nice because, they come deflated, and they can be filled to a certain size that you want with normal saline fluid. And they are approved by FDA in younger women, age 18 to 22. So those implants are actually commonly used in a young female population.
So with the saline and or silicone implants, is there any probability of leaking these implants?
Yes, there's a very small chance of any of those implants leaking over time. Those implants are not permanent. They do have a lifetime of about 10 years. It's recommended to replace them. And so there's a very small chance that they would leak. A saline implant, when it leaks, you would know right away because it deflates immediately in your body, and there's going to be a noticeable size difference or shape difference. With silicone implants, now that we have especially those highly cohesive, or they're called gummy bear implants, even if they leak, you won't necessarily know about it. They don't actually leak. The shell becomes weakened over time, and it can form a little defect in it and create a little deformity, but it will not be noticeable usually just by looking at your own body, and that can be detected by an MRI.
Okay, so with the reconstructive surgeries, how long is the implant stay in place before it is changed, or is it changed at all?
It's a good question. I would say most women who had breast reconstruction actually end up having their implants for a very long time, and nothing happens to them, and they go on to live their life, and they don't have another surgery. Whereas in some cases, when there is an implant rupture, it usually occurs beyond 10 years. And so that's when I would see a patient and they would need what's called an implant exchange. It's a very simple and quick procedure that's done in the operating room. The ruptured implant is removed and the new implant is placed in the same pocket. So that happens very rarely, and I would say that most patients don't come in every 10 years to just automatically switch the implants out. Most patients just go on and live their life, and nothing happens.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about plastic surgery with Dr. Domantovsky. And today we're talking about plastic surgery. She is a board-certified plastic surgeon with Plastic Surgery of New York, located in Great Neck here in Nassau County. So we're talking about breast reconstructive surgery right now. Let's move on to things like tummy tucks and liposuction. Tummy tucks typically is done with people possibly who have had bariatric surgery, or maybe someone who's had a C-section, or someone who probably is, the adipose tissue in the abdominal area is just hard to get rid of, right? So when that particular fat deposit is taken from the patient, how do you handle the sagging skin, or what is done to make that area look cosmetically pleasing?
That's an excellent question. So the procedure we're talking about is abdominoplasty or tummy tuck. And you're right, it's done in patients who had significant weight loss, or even women who went through several pregnancies. Over time, they develop loose skin from the pregnancy. That's also a common reason. Abdominoplasty involves removal of the skin from the lower belly. And then tightening or pulling down the remaining skin from the upper belly all the way down, which makes the contour of the abdomen a lot flatter and the skin tighter. And this procedure often is combined with liposuction at the same time to remove some of the fatty deposits, especially on the flanks or thighs, hips, for a better contour of the overall body, torso itself. This is done in the operating room. You're completely asleep. Usually takes 2-3 hours, and you go home the same day.
So when you go home after a tummy tuck, are there any kind of tubes or Jackson Pratts or any kind of things that take the fluid away from the incision line? What goes into that?
Yes, so a lot of surgeons, including me, we do put drains. They're called drains, or
Right.
tubes that drain the fluid that can accumulate underneath the skin immediately after the abdominoplasty. And those usually patients go home with them, and those usually stay in for about a week. It depends on how much they're putting out, and the patient usually keeps track of how much fluid is coming out every day. And then typically I would see the patient in my office within a week, and we'll check the output. And most of the time the drains are removed at that point. And it's usually 1 to 2 drains. Occasionally, a drain may not even be placed in abdominoplasty. Sometimes I put internal quilting sutures. These are the stitches kind of underneath the skin that are used to obliterate the empty space that's been created by the surgery, so the fluid cannot accumulate there. So that's another technique that some people, including me, use to avoid the drains.
Great. And how about the liposuction? I know that, again, that's a removal of the fatty deposits, no matter where it is in the body. What is the possibility of that fat coming back to the area that was removed from those areas?
So that's an excellent question, and many people ask that. It is possible to have the fatty deposits come back and to regain the weight if you're not doing your job in maintaining the result that you have after the surgery. And what I mean by that, if you let yourself go and just eat everything you want, and especially if you're genetically predisposed to accumulate fat, let's say in the flanks, you can certainly, that can certainly come back over time after the surgery. So once you have the liposuction surgery, you have to kind of try to maintain that status of your body and that shape by watching what you eat. It helps if you exercise, and just be careful with the way you lead your lifestyle and your diet and just physical activity. So most people don't end up gaining weight because they're very motivated. They've invested in their surgery and they want to keep that result. So they're motivated to live the way that they could prevent reaccumulation of fat. So it's very rare. Certainly it's possible, but I think if you're at a point where you have the liposuction and you're invested in having that done, you're pretty motivated about just keeping that the same over time, the result the same.
And doctor, how often you call to the emergency room for a possibility of maybe a laceration, or I know I'm a nurse, so I see a lot of lacerations and gun stab wounds and all of this, and people want to return to their beauty before the trauma. How often are you called to the emergency room for those reasons?
So plastic surgery is such a broad field, and as a plastic surgeon, I do take call for lacerations or any kind of facial or hand injuries pretty much every week. So I do take a lot of call, and I see a lot of patients that have had some kind of trauma to their hand. I do treat hand fractures. That does fall within the scope of plastic surgery. Same with facial fractures. A lot of lacerations that young people sustain, or even kids, it happens. And so as a plastic surgeon, I get to help them and create the best possible result for them. And that's very rewarding.
So when you're doing a repair of a laceration, what technique sets you apart from a regular attending physician? I know that you do have the extra years and significant extra years in studying this. Is it the way you handle the suture? Is it the way you approximate the wound? What is it that you would say makes your work so that we're coming away knowing that we're going to have a very reduced scar and it looks very pleasant to the eye?
So three principles: making sure that the wound is clean, and that includes eliminating any chance of infection, cleaning the wound, removing any non-viable or questionable or crushed tissue. And then the second thing is actually how we handle the tissue, and when we're actually putting stitches in. We have to be very gentle and we have to know the anatomy and different layers of the skin and make sure when we put it back together, the layers come on exactly the same level. And then it's also what kind of stitches we use and the type of repair that we use that make the skin edges what we call evert, or kind of come up together in a way that it's very precise and actually slightly elevated, so that when it heals, it flattens out and becomes a very thin, flat scar.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and we're talking about plastic surgery, and with a board-certified plastic surgeon who is located in Great Neck here at Nassau County. There's so much to talk to your doctor about with regard to plastic surgery. I want to ask you about laser treatments. With the laser treatments, what is laser? And what is the distinction of laser versus the typical surgery that we would see?
So laser procedures, compared to surgery, they're done in the office. You don't need to go to sleep for it. A laser is basically, essentially a machine that uses light energy to treat different skin spots like brown spots, spider veins, different vascular lesions, skin resurfacing, tattoo removal. And so the machine uses different wavelengths of light to target different colors of the spots in your skin and different irregularities of your skin. So if you're having a laser procedure, you typically come into the office. Typically the procedure can be from 15 minutes to 30 minutes. Some lasers are a little bit more painful than the others, and sometimes we use numbing cream, where we apply cream, let's say on your face, that takes 20, 40 minutes to absorb, and it numbs up your skin so you're not feeling the kind of the pulse of the laser as much. But it's certainly very tolerable by patients. You don't need to go to sleep for it like you do in surgery. It's quick. It's in and out in the office. Typically requires several treatments to make a spot go away, and those are usually spaced 4 to 6 weeks apart. So if you're having laser procedure, you would expect that you'd have several laser treatments over time to completely eliminate whatever you're trying to remove.
I wanted to ask you this question, and this question probably has come up many times in your experience. When you are doing a liposuction or remove adipose tissue from an area, what happens to the vessels as you're sucking out? Is there a chance that I am sucking with the fat vessels that I'm removing? And tell me about that.
Yes, of course. So during the liposuction procedure, before we suck out the fat, we inject the fluid that contains a numbing medicine like lidocaine and epinephrine. And a mixture of that fluid actually it narrows your blood vessels and makes it less of a chance for them to bleed or be injured. And so that helps extremely in preventing injury to the blood vessels when we put in a suction cannula and start removing the fat. So typically the vessels are not sucked into the cannula. They clamp down, and at that point they're fairly elastic, and they don't just get sucked in, but they also don't bleed as much because of the epinephrine effect. And so typically with liposuction, most of the fat gets removed, and a little bit of the fluid that looks blood tinged, and we all have that underneath the skin. So it's normal to have a little bit of bruising after liposuction, but nothing like a big bleeding or the concern that the blood vessel gets sucked in. That doesn't happen. So it's very safe.
And how often do you do Botox? Is that something that is still commonly done?
Yes, that's a very popular procedure. I do Botox a lot. There's a lot of patients, all ages, including young people, that want to do it in a preventive fashion to prevent the wrinkles. So it's a very popular procedure. You would come into the office. It takes about 10, 15 minutes. Depending on the areas that we try to improve, that takes a certain number of units of Botox, and we plan our injection points in the skin. And you'll be done in about 15 minutes. Botox, once you have it, starts working. You see the effects of it within a week or two, so you won't notice it immediately when you had it done. It can take up to 2 weeks for the full effect, and the first treatment typically lasts 3 to 4 months.
Are you seeing more of an increase of older adults in your office? I know we're living longer. And so, I in the hospital have seen many centenarians, people who are 100 or more. Are you seeing more of a rise of older adults coming to the office and wanting plastic surgery?
Definitely. There are people that reach a point when they retire and they're done working and they want to enjoy their life. And they're thinking about the quality of life and how they're going to live their life on a daily basis. And they want to enjoy it. And also, I find that they want to improve their appearance and how they feel about themselves. So that's the age group that typically would be interested in a facelift or removal of the excess skin, like a tummy tuck or a thigh lift. So we're definitely seeing more elderly patients that now have more time and they want to enjoy their life, and they do pay attention to how they look and want to improve their appearance.
How can the listening audience contact you, doctor?
So we can be contacted at 1-855-PSNY-123. That's our phone number. Or you can look and visit our website. It's www.plasticsurgeryofnewyork.com. And we do have several locations: Great Neck, Queens, and Manhattan. So we cover a large area of the city.
Wow, very good. So you're saying 1-855-P as in Paul, S as in Sam, New York, NY 123. Is that right?
That's correct. That's correct.
Is there anything that you would like to, in a couple of words, anything that you would like to leave with us, more information? If we want to pick a plastic surgeon, we need to look at what?
So if you're considering or thinking about plastic surgery, it's very important that you do your research and make sure that the surgeon that you're considering is board certified in plastic surgery. That means they've gone through all the required training and passed all of the necessary exams to be considered safe and competent to do your surgery. So I think it's very important. I also think it's important to go on the practice website, read about the surgeons you're looking at, and I find that a lot of people choose a surgeon that they can identify something or relate to personally, or that you want to feel comfortable with the surgeon who's going to be potentially doing your surgery. And so first thing is to make sure they're board certified. And second, you want to read about them and see if, it's someone that you want to see, and then come in and see us for a free consultation. And I think that's when you'll know, when you talk to the surgeon in person and have your consultation, that's when you'll know whether you're comfortable and satisfied with all the explanations and what you talked about, and whether you feel comfortable proceeding.
Well, thank you so much for being here, Dr. Domantovsky, a board-certified plastic surgeon with Plastic Surgery of New York, located in Great Neck, here in Nassau County. We hope you will stay safe and continue to do great work in Long Island.
Thank you very much for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and I want to thank you, the listening audience, for taking the time to listen to this edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.